Hello and welcome everyone to the part 2 of Kent's 12 observations. I've already shared with you observations 1 to 6, and these are very important practically when you're dealing with patients, and it's important to understand, have a good understanding of your fundamentals, and because these are the basics, pillars of homeopathy on which our philosophy stands. And very many times in the Western world these observations are not even taught in the curriculum. So I hope you will be able to incorporate this and use this practically as well. So we come to observation 7. Observation 7 deals with full-time amelioration of the symptoms, yet no special relief of the patient. The words of Kent, a full-time amelioration of the symptoms, yet no special relief of the patient. So very many times what can happen is a patient who has a single kidney, he was congenitally, there's a defect in the kidney, or it was removed because of some other ailment, or there are a lot of structural changes in the organs. So often you will find that perhaps a patient in the terminal stages of cancer, they are dealing with irreversible pathological changes, irreversible structural changes, and in such cases you may prescribe a homeopathic remedy. You may prescribe a similimum which will help the patient from time to time, but there is not a possibility of complete recovery because the structural changes have occurred to such an extent that complete recovery is not possible. You have to understand the pathological standpoint here. Many times you get a patient in the functional state, so where there are only functional symptoms, there is no structural changes. When that functional state continues, patient has been untreated homeopathically, you will get a stage of reversible structural changes. So reversible structural changes. For example, there is a growth, a nodule, a fibroadenoma, which is a structural change, but is reversible, you can revert it. But very many times again, when that is untreated, it goes into the stage of irreversible pathological changes and irreversible structural changes, where a patient has undergone massive fibrosis of the lungs. He has been a patient of asthma for a long time, and there is now extensive fibrosis of the lungs, which is unfortunately not reversible. So irreversible structural changes, and in such cases, that is the condition where homeopathic palliation is possible. You prescribe a remedy which will give relief from time to time, the similimum will give relief from time to time, but there is no possibility of a complete cure because the patient has gone beyond that state, and that is where you need to do a homeopathic palliation. That is also applicable sometimes in the terminal stages of cancer as well. So I'll read this from Kent's philosophy. A patient with one kidney can only improve to a certain degree with structural changes that have been there in certain places. It is only capable of doing limited work. These symptoms will be ameliorated from time to time with remedies, but the patient is only curable to a certain extent. He cannot go beyond and rise above such a state. So that's the state of homeopathic palliation. Patient will get relief, but there is not a possibility of complete cure. Remedies act favorably, but the patient is not cured and can never be cured. The patient is palliated in this instance, and is a suitable palliation for homeopathic remedies. That is what we call a homeopathic palliation. Kent's 7th observation, where there are structural changes which are irreversible, and that is the best you can do in such a state. We come to the next observation, is observation 8. And observation 8 deals with idiosyncratic individuals. I will try to do a separate section on idiosyncrasy, but observation 8 deals with idiosyncratic individuals who prove every remedy they get. Some patients will come and tell you, I have had a very bad experience with homeopathic remedies because whatever I take it, more symptoms come up, I seem to prove it. And if they are homeopaths, God help you, because they will tell you there are symptoms of this remedy and that remedy. So every time I take a remedy, new symptoms come up, or I prove that remedy. And that can happen in a few instances, and that is Kent's 8th observation. Some patients prove every remedy get. Now there are some ifs and buts to it. Kent says that many times when you give a high potency of a remedy, they start proving that remedy, it's like the patient is under the influence of that remedy and nothing else. So there will be a period of prodrome, period of progress, period of decline, and they will be proving lots of symptoms of that remedy in a high potency, even if you're giving it in a minimum dose. So what is the alternative to it, or what is the solution to it? A, you can give the lower potencies of the remedy. So, Kent says 30C is always a universal potency. So if you come across people who are proving every remedy they get, or they are very sensitive to the high potencies, drop down, go to a 30C, and they will better respond to that potency. And Kent, in his philosophy in different other areas, has mentioned very many times, if you come across people who are idiosyncratic, who are proving every remedy, try a dose of nitric acid. Nitric acid is a remedy which can help to at least lessen the effect of idiosyncratic individuals. Will not prove as many symptoms, or will be less susceptible to prove many symptoms after taking a remedy. So observation 8, some patients prove every remedy they get. You can call them hysterical, you can call them idiosyncratic, you can call them sensitive, but that is how it is, and you'll get people who are like that. I'll just read this from Kent. Some patients prove every remedy they get. Patients inclined to be hysterical, oversensitive to all things. The patient is said to have an idiosyncrasy to everything. You administer a dose of a high potency and they will go on and prove that medicine. And while under the influence of that medicine, they are not under the influence of anything else. So it's like that remedy has taken its course and they are proving most of the symptoms of that remedy. It takes possession of them and acts as a disease does. Remedy has its prodromal period, period of progress, period of decline. Such patients are provers and they will prove the highest potencies. When you find the patient that proves everything you give in the high potencies, go back to the 30th and 200. So you can drop down, as I mentioned, give a lower potency, and that will help. Many of them are born with this sensitivity and they will die with it. Such oversensitive patients are useful to the homeopathic physician. After they get out of one proving, they are quite ready to repeat it or go into another. So if you are into drug proving, they are good for you, but as a clinician, as a physician, it's not always favorable, because they're giving you lots of symptoms and you may get confused. So A, remember to go to the lower potencies, a 30C is favorable, and B, many times a dose of nitric acid can help at least lessen the array or spectrum of symptoms that they are producing. So that's Kent's 8th observation. We come to Kent's 9th observation. And Kent's 9th observation is the action of medicine upon provers. Hahnemann has mentioned a lot of times in his discussion on drug proving that if you prove a drug, that will only improve your immunity and disease resisting power. So drug proving is always a good thing to do. And Kent supports that idea as well. 9th observation is action of the medicine upon provers. So healthy provers who are proving the remedies, that's always a good thing. But Kent says, always know what are the constitutional symptoms first and then subtract it or separate it from the symptoms which you are getting during drug proving. So it's not very difficult to understand. 9th observation is the action of medicine upon provers. Healthy provers are always benefited by provings if they are properly conducted. It is well to observe carefully the constitutional state of the individual about to become a prover and to write these down and subtract them from the proving. So note the constitutional symptoms, and then you can assess it or separate it from the symptoms during proving. And that is our easy 9th observation. We come to the 10th observation, very practically important. 10, 11, 12. Now 10th observation, you have to understand this well. Kent says, when there is a lot of new symptoms coming up after approving, after administration of the remedy. Now, I'll share with you first Kent's ideology. Many times when there are a lot of new symptoms coming after a remedy has been prescribed, the prognosis is not good, because A, new symptoms coming up shows it's not on the path to recovery, and B, many times what can happen, after you've given a wrong remedy, new symptoms have come up, and over the course of time the new symptoms have gone, the patient settles down to the original state and there has been no improvement at all. So the patient comes to you in the first follow-up, this has come up, this has come up, this is new, you're waiting. You wait and watch, you give placebo. Next time when they come back, you see those are gone, I've come back to my original state, there has been no appreciable change, stand still. So new symptoms appearing after the administration of remedy, and this is, we're talking about, we're giving a single remedy, giving it a minimum dose, but still new symptoms coming up. It's not a good prognosis, A. But B, there is a if and but to it. Along with Kent, I have shared with you in the first discussion, the name of the chapter is Prognosis after observing the action of the remedy. So when you are going through this, also there is another chapter in H.A. Roberts, there is a book by H.A. Roberts, The Principles and Art of Cure by Homeopathy. And H.A. Roberts, the chapter name is Remedy Reaction, and that is also Remedy Reaction. And that is also a good read, which also illustrates Kent's observation. And there H.A. Roberts mentions that in a case of one-sided disease, section 173 to 184, Hahnemann deals with one-sided disease. And there H.A. Roberts says, in a case of one-sided disease where there are few available symptoms and you are prescribing a partially similar remedy based on the few available symptoms, and after administration of the remedy there have been new symptoms which have come up. Only, my friends, only in the case of one-sided disease, when you get new symptoms after administration of a partially similar remedy, that's a good sign, because now you combine the new symptoms with the existing symptoms. So new plus existing symptoms, you combine them, that is the status morbi, that is the status morbi or the existing state of the patient, and you prescribe a much better indicated remedy. And that is the only chance or place where prescribing on few available symptoms and new symptoms have come out, that's a good sign. I repeat again, in a case of one-sided disease, there are few symptoms, 1, 2, 3. You're not getting a clear picture of the disease, you're not getting a clear picture of a constitutional remedy. You're prescribed a partially similar remedy. When you prescribed a partially similar remedy, few more symptoms came up. So with the 1, 2, 3, 4, 5, 6 were added. So now you combine 1 to 6. New symptoms are 4, 5, 6, and the existing symptoms are 1, 2, 3. So symptoms 1 to 6 you combine. That is the status morbi. Hahnemann's exact words when he discussed one-sided disease, 173 to 184. Make sure you read it. And that status morbi, symptoms 1 to 6, will help you in selecting a suitable remedy which will cover the entire condition. So when it is a clear picture of the disease, you are prescribing a single remedy in a minimum dose, but new symptoms have come up, not a good sign. The more the array of new symptoms that come up, the worse is the prognosis. What happens over the course of time? The new symptoms will go away. Patient settles down to the original state, no improvement, no appreciable change. Only in the case of one-sided disease, 173 to 184, few available symptoms, you prescribed a partially similar remedy, few more came up. And that will help you in prescribing a better remedy. You'll find in many cases, for example, tuberculinum. It's mentioned in Borike's relationship part. The first dose of tuberculinum in any difficult case is, however, the most weighty prescription. So why? In a difficult case, you're not getting clear picture, you prescribe tuberculinum, more symptoms came up. You combine those and you prescribed the better indicated remedy. So very many times this is important to understand, where there is less symptoms available, if new symptoms come, that's a good sign. And that is observation 10. We come to observation 11. And observation 11 is when old symptoms come up after administration of the remedy. When old symptoms are observed to reappear. Now, to understand observation 11, you have to always obviously remember at first is Hering's law of cure. And this you can again get in the chapter on remedy reaction. Hering's law of cure mentioned when patient is improving, the disease goes from above downwards, A, from within outwards, B, from more important organ to less important organ, C, and D in reverse order of their appearance. So symptoms which came first goes last. So above downwards, within outwards, center to periphery, center to circumference, from more important to less important organ, and in the reverse order of their appearance. Now Kent says in the 11th observation, when old symptoms are reappearing, oh, I had this in my childhood, that has come back again. Remember, that's a good sign. And tell the patient, when old symptoms are reappearing, you're on your way to recovery. Now, what is the prognosis? Always a good sign that yes, patient is on the way to recovery. Tell the patient that you're on the way to good health. Most of the time, old symptoms come, stay for some time, go away. Don't use your restless fingers. Don't prescribe a remedy in that state. Kent says, if the old symptoms remain for some time, I had this headache 15 years back, it's come back again. It's there, it's been there for last few months. What you do? You prescribe another dose of that remedy which has brought that symptom back, and sometimes that will be taken care of with that dose of the remedy. So in most cases, A, wait and watch. Old symptoms will come back, they will go away on its own. B, if the old symptoms persist, if they're not going, prescribe a dose of that remedy which you have prescribed earlier, and that will take care of its eradication. So observation 11, when old symptoms observed to reappear. I'm reading this from Kent. It is quite a common thing for old symptoms to appear after the aggravation has come, and hence we see the symptoms disappearing in the reverse order of their appearance, and that's again Hering's law. Those symptoms that are present subside, and the old symptoms keep coming back. The physician must know himself that the patient is on the road to recovery, and it is well to say to the patient that this is encouraging. So tell the patient you're on the way to recovery. Old symptoms often come back and go off without any change of medicine. So they will come back and go off without any change of remedy. It indicates that the medicine must be left alone, do not interfere. If the old symptoms come back to stay, if they're persisting, then a repetition of the dose is often necessary, of dose of the remedy which has been curable. So that is very important to remember about Kent's 11th observation. And now our last observation, or 12th observation, is unfortunately not a good observation. When symptoms take the wrong direction. You prescribe to the patient for skin symptoms, itching. He comes back to you in the first or second follow-up, the itching is gone. I'm now having a lot of palpitations. Itching is gone, I'm now having a lot of anxieties. Itching is gone, I'm having neuralgia, numbness and tingling in my extremities. So symptoms have taken a wrong direction. It has gone from the periphery to the center. It has gone from a less important organ to a more important organ. So symptoms have taken a wrong direction. And when the symptoms have taken a wrong direction, again, it is well to remember Hering's law. It is going from the less important to a more important organ. The remedy must be antidoted at once. Now, when you hear the word antidote, you don't have to search in Borike's Metromedica or any other book, what is antidote of that remedy? No. Hahnemann says again this very clearly, that whenever a remedy has given an unfavorable response, do a fresh case taking, take the case. The next best indicated remedy is the best antidote. So you don't have to look in what is the antidote of that remedy always to find and have to prescribe that. Do a fresh case taking, find out the present and existing state, and prescribe the similimum according to that condition, and that will be the best antidote in a minimum dose. So it's very important to know, A, if symptoms are taking the wrong direction, you must be careful. B, if that has happened, you need to antidote it, but antidote it with the next best similimum. 12th observation, we all notice sometimes that symptoms take the wrong direction. If you prescribe for a rheumatism of the knees or feet, or rheumatism of the hands, and relief takes place at once in the rheumatism of the extremities. So prescribe for joint pains are better, but the patient is taken down with violent internal distress that settles in the region of the heart or centers in the spine. So his joints got better, but now there are cardiac symptoms, now there are spinal neuralgic symptoms. You see at once a transference has taken place from circumference to center. So it has gone from the less important to the more important organ. And the remedy must be antidoted at once. I think, I don't remember exactly right at the moment, but I think it's section 249 where Hanuman mentions you need to antidote, but if the antidote is needed, it should be the next best imam. When disease goes from center to circumference, going from centers of life out from the heart, lungs, brain and spine, out from the interiors upon the extremities, it is well. So again, it is important to remember heading's direction of cure from center to periphery, and that's how it should happen. So that's about your 12 observations of Kent. These are very important practically, my friends, and you know, if you know your basics, if you know your fundamentals, you can learn different methods, different systems. But Kent's philosophy, if all of you do not have this book, get that online. It's a very important part of learning the basics of homeopathy, and that will make you a confident prescriber. So you know what to do when something goes wrong. Every case is not a fairy tale. You know, you'll not get wonderful response from a single remedy. You'll get botch up cases, but it's important to know how you can pick up the pieces and take them forward in those botched up cases. And that is where Kent's observation will help you in many conditions, and that's why I thought it's an important learning in the philosophical aspect. Thank you very much. Long live Hanuman, long live homeopathy.